Bon vendredi tout le monde.
Happy Friday, everyone. I am happy to be here today. Virtually, we have Ministers Qualtrough and LeBlanc. Here in the room, we have Dr. Tam and Dr. New.
First minister's call since the pandemic began. In our meeting, the premiers and I spoke about the surge of COVID-19 cases we're experiencing right across the country. This week, Alberta, Manitoba, and Saskatchewan all set new records for COVID-19 hospitalizations. Yesterday, Ontario reported over 1,500 new cases, a record high for the third day in a row. New projections are suggesting that the province could be on track for over 6,500 cases a day by mid-December. We also set a new daily national record yesterday with nearly 5,000 new cases in Canada and 83 more Canadians lost to this virus. We have to reverse these trends now. Last night, we heard directly from the premiers about the current challenge, about the difficult choices different provinces are making. For instance, Manitoba, which weathered the first wave better than most, is now getting hit hard. On that front, I can announce that Minister Blair until January 15th, 2021. The Canadian Red Cross is already on the ground assessing the situation and is working with local and provincial authorities to determine their specific needs. COVID-19 surges like the one they're experiencing in Manitoba can happen anywhere. So we all have to be vigilant in every part of daily life and in every part of the community. I reassured the premiers that the federal government will always be there to help, but reminded them as well that our resources are not infinite. Controlling the virus now reduces the chances of impossible decisions and choices we might have to make down the road. Finally, we raised the need for further collaboration on distributing a safe, effective vaccine across the country once it's ready. On Monday, we got some much-needed encouraging news about a potential vaccine. That's good. We could all use a little hope these days. But we also have to remember that right now, our fight against COVID-19 is far from over. The vaccine won't help you or your family if you get COVID-19 now. That's why we all need to keep working together to bend the curve, to protect each other, and to save lives. Présentement, notre priorité.
Right now, our priority is protecting Canadians. We have taken action to directly protect families, businesses, and workers to weather the crisis. We are also helping provinces, territories, and municipalities. We know that there are many challenges for municipalities. They are on the front lines and they're offering essential services to their citizens every day. In the Safe Restart Agreement, the federal government invested heavy sums to help municipalities in Quebec. This made it possible to, for example, improve public transportation services. We must not let our guard down. Yesterday, we had our 21st First Minister's call with premiers of provinces and territories. We discussed the action that we will be taking together to deploy a vaccine and also to continue to fight the pandemic. We continue to share our experiences and learn together. We must continue our efforts. We must slow the spread of the virus, and we must work as Team Canada with all levels of government in order to succeed. Last night, during the First Minister's call, I spoke about the very positive conversation that I had with our ambassador to the United States and also with the President-elect Biden on Monday. Furthermore, I'd like to announce that we will be supporting long-term care homes in Quebec until January 15th, 2021. We thank all the men and women in uniform for their hard work, professionalism, and dedication.
Workers and businesses during the second wave, we've extended the wage subsidy, created the new Canada Emergency Rent Subsidy, and expanded eligibility for the Canada Emergency Business Account. Now, more than ever, The labor market is evolving quickly, and workers need to be able to develop new skills. To help Canadians access training and services, we're already providing $3.4 billion to the provinces and territories under the labor market transfer agreements. Today, I can announce that we will invest an additional $1.5 billion in the workforce development agreements. This new investment will ensure quick access to training so that workers in sectors hardest hit by COVID-19, as well as underrepresented groups like persons with disabilities, women, and Indigenous peoples, can find and keep good jobs. This is another step towards creating 1 million jobs and rebuilding an inclusive economy that benefits all Canadians. Minister Qualtrough will have more to say on this important announcement in just a few moments. Le marché du travail évolue.
The labor market is quickly evolving and changing. It is important that workers be able to develop new skills and have access to training. Some sectors of the economy have been hit especially hard by the pandemic. Our government wants to help those workers retrain and gain new skills so that they can rejoin the workforce quickly. Today, we are announcing an investment of an additional $1.5 billion in workforce development agreements. We are increasing resources for training. This will help employers find and keep good employees and help employees find and keep good jobs. We need a strong, well-trained workforce in order to build an inclusive economy that benefits all Canadians.
Recognizing that we're coming into yet another weekend where many Canadians are being asked to stay home. It's not easy, but we can't let our guard down. I know you're probably getting sick of hearing this, just like you're sick of hearing about COVID-19. It's been a tough year, and we all want this pandemic to end. But we have to do our part to flatten the curve before it gets any worse. So I'm asking you, yet again, to do your part and follow public health instructions. If you're not exactly sure what those are in your area, visit your local government's website. Continue to wash your hands. Wear a mask. Keep your distance. Get the flu shot. Avoid gatherings and download and use the free COVID Alert app. Many people with COVID-19 don't know how they caught it or from where. That's what makes the app so important. It notifies others and notifies you that you've come into contact with the virus, maybe without even knowing it. As of today, over 4,000 people have already reported their positive test result by entering their one-time code into the app. That means thousands more were then alerted and able to take proper precautions. That's a great start, but I know we can do even better. So please, if you get a positive test result, enter your one-time code into the app so it can do its work and we can all slow the spread of the virus.
It's great to hear good news, especially these days. We must remain hopeful, but let's not forget that the fight is far from over. Many of us are sick of hearing about COVID-19. It's annoying, it's bothersome, we want to move on. We understand. We all have reasons to remain vigilant. We all want to protect frontline workers and essential workers. We can and must do everything in our power to slow the spread of the virus. We must all do our part. Governments are doing their part. Public health authorities are doing their part. Frontline workers are doing their part. We can't succeed without everyone. All Canadians and all Canadian families must make wise choices. We must decrease our case count as soon as possible in order to get through the winter and in order to save lives. Please follow local public health instructions. Please wash your hands, wear a mask, physical distance, get your flu shot, avoid gatherings. Also, please download the free COVID Alert app. 5.2 million Canadians have already done so. You should join them. Once you're on the app, should you receive a positive test result, please enter your one-time code. That will alert all those you've been in contact with. This situation is not easy, but together we will get through this. Take care this weekend. Take care in the upcoming days. And now, let us hear from Minister Qual.
Bonjour. Thank you, Prime Minister. It's a pleasure to be here virtually with you today for this important announcement on our investment to help Canadians across the country access the training and services they need to return to the workforce and get back to work safely. Comme l'a mentionné le Premier ministre,
As the Prime Minister said, the labor market is changing quickly. We must support employers and workers so that they can keep pace with all these changes.
and the uncertainty of the pandemic creates a challenging situation for both employers and workers. I'm also thinking about people working in sectors especially hard hit by the pandemic, such as manufacturing, retail, transportation, tourism, and recreation, just to name a few. As the Prime Minister said, we're investing an additional $1.5 billion in the workforce development agencies with all 13 provinces and territories. These additional investments will flow through a strong delivery network of employment service centers already in place across Canada. De nombreux Canadiens sont
So many Canadians are not working right now. All levels of government must work together to ensure that our employment networks and agencies everywhere in Canada are supporting workers.
services for Canadian workers, especially those in sectors hardest hit by COVID-19. It means that provinces and territories will have more funding to better support program delivery through service centers like Work BC in my home province of British Columbia. Ou, par exemple,
This will also help training and employment programs offered, for example, in Quebec by Emploi Quebec or Work NB in New Brunswick. Our partners in provincial and territorial employment networks are those who can help employment in Canada.
on the job training, financial assistance and benefits, employment counseling and services, employment opportunities, and employer-sponsored training, whatever they need to help them find, prepare for, and maintain good jobs. In the speech from the throne, we committed to making the largest training investment in Canadian history. We also launched a campaign to create over 1 million jobs to bring us back to where we were before the pandemic started. Well, this additional $1.5 billion is the first step towards those goals. It will create a stronger workforce and a stronger Canada. I'd like to thank our provincial and territorial partners for their continued collaboration in getting Canadian workers the training they need to get good jobs as our country gradually recovers from the impact of COVID-19.
We are going through tough times. We will get through this by working together.
To Dr. Tam for the public health update. Thank you. Merci beaucoup.
Good afternoon, good day, bonjour à toutes et tous. There have been 282,577 cases of COVID-19 in Canada, including 10,748 deaths. Nationally, there are over 45,000 active cases across the country. Over the past week, labs across Canada have tested an average of is now over 4,300 cases reported daily over the last 7 days. The number of people experiencing serious illness continues to increase, with an average of over 1,400 individuals with COVID-19 being treated in Canadian hospitals, including 280 in critical care, and an average of 55 deaths reported each day over the past 7 days. Western provinces saw weekly increases in daily hospitalizations ranging from 24% to as high as over 50% compared to last week. Quebec and Ontario saw a lower percent increase, but continue to have the highest numbers of people being treated in hospital for COVID-19 in the country. This situation is very worrisome, as it is putting pressure on local healthcare resources. Hospitals are being forced to make the difficult decision to cancel elective surgeries and procedures in areas of the country. And healthcare workers are exhausted everywhere. The continued spread of COVID-19 impacts all of our well-being, and we all must take action to help reduce the spread of the virus. If we continue on the current pace, it is estimated that there will be over 10,000 cases daily by early December. An important driver of this increased disease activity continues to be informal social gatherings and activities both inside and outside our homes. In these more relaxed settings, such as family get-togethers, birthday parties, holiday celebrations, and recreational activities, it is natural to relax. But this can mean it is easy to forget and to let our guard down on the necessary precautions. Unfortunately, the virus will take any and every opportunity to spread. So our best protection for ourselves, our family, and our community is to consistently maintain public health practices and avoid settings and situations that increase the risks for spread. For these reasons, public health authorities are urging people to reduce the size of gatherings and limit activity to just our existing household members whenever possible. If you spend time indoors with people from outside of our immediate household, it is strongly recommended that everybody wears a non-medical mask. Our primary goal for the pandemic response remains to minimize severe illness and deaths due to COVID-19. As always, layering of prevention practices is the most effective protection. Stay home and self-isolate if you have any symptoms, even mild ones. Clean your hands frequently, maintain physical distancing, wear a non-medical mask or face covering when indoors with people from outside of your immediate household, and avoid or limit time spent in the 3 Cs: closed spaces, crowded places, and close contact settings, and situations where you cannot consistently maintain physical distancing. As the Prime Minister has said, please, all of us do our part to flatten the curve. Thank you.
Bonjour à toutes.
Hello, everyone. There have been 282,577 cases of COVID-19 in Canada, including 10,768 deaths. Nationally, there are over 45,000 active cases. Over the past week, labs across Canada have tested an average of close to 55,000 people daily, with almost 6% testing positive. The national average case count is now 4,348 cases reported daily over the last 7 days. The number of people experiencing severe illness continues to increase. Over the past 7 days, there was an average of over 1,400 individuals with COVID-19 being treated in Canadian hospitals, including 280 in critical care, and an average of 55 deaths reported each day over the past 7 days. Western provinces saw weekly increases in daily hospitalizations, ranging from 24% to as high as over 50% compared to last week. Quebec and Ontario saw a lower percentage increase, but continue to have the highest numbers of people being treated in hospital for COVID-19 in the country. This situation is worrisome. It is putting pressure on local resources in healthcare. Hospitals are being forced to make the difficult decision to cancel elective surgeries and procedures in areas of the country. Moreover, our healthcare workers are exhausted. The continued spread of COVID-19 impacts all of our well-being. We must all take action to help reduce the spread of the virus. If we continue at the current pace, it is estimated that there will be over 10,000 cases daily by early December. An important driver of increased disease activity continues to be informal social gatherings and activities, both inside and outside our homes. In these more relaxed settings, such as family get-togethers, birthday parties, holiday celebrations, and recreational activities, it is natural to relax. However, this can mean that we forget or let our guard down on the necessary precautions. Unfortunately, the virus is more likely to spread in these relaxed contexts. So our best protection for ourselves, our families, and our communities is to consistently maintain public health practices and to avoid settings and situations that increase the risks of spread. For these reasons, public health authorities are urging Canadians to reduce the size of gatherings and limit activities to just our existing household members wherever possible. If you spend time indoors with people from outside of your immediate household, it is strongly recommended that everyone wear a non-medical mask. Our primary goal for the pandemic response remains to minimize severe illness and deaths due to COVID-19. As always, the most effective protection is to layer prevention practices. Stay home and self-isolate if you have any symptoms, even mild ones. Clean your hands frequently. Maintain physical distancing. Wear a non-medical mask or face covering when indoors with people from outside of your immediate household. And avoid or limit time spent in the 3 C's: closed spaces, crowded places, and close contact. That is, avoid or limit time spent in settings and situations where you cannot consistently maintain physical distancing. Thank you.
20-minute question period for the PM. Doctors and ministers will remain available afterwards for more questions, starting with the phone today, following with questions in the room. Merci beaucoup, Dr. New. Nous allons aussi...
Thank you, Dr. New. We will now take questions for the Prime Minister for 20 minutes. We will first take questions on the phone lines and then questions in the room. Following the Prime Minister's availability, the ministers and doctors will be available to take questions. Operator, questions over the phone.
Go. Toronto Star, line open.
Hi, thank you very much for taking my question. Prime Minister, while your government has spent billions and billions of dollars through the pandemic, some of my colleagues in Toronto yesterday reported that none of the $250 million you promised to tackle gun violence has flowed to cities, and we still have no handgun ban legislation. So where is the legislation you promised? Where is that money? And what do you say to the family of the 12-year-old boy who was shot and killed in Toronto this week before you could fulfill either of those promises?
Obviously, our hearts go out to families who've been victims of gun violence across the country, and particularly in Toronto, where we've seen too many tragedies like this. As a government, we've moved forward over the past 5 years on many measures to strengthen gun control, to bring in new rules and regulations, to move forward on restricting access to guns, restricting the flow of guns across our border. But we know there's much more to do. We made a commitment to ban military-style assault weapons, and we have. We made a commitment to move forward on giving municipalities the capacity to ban handguns as well. And that one, because it's not necessarily something that all provincial governments are agreeing with, is something we continue to work on. But we will move forward on that, and we have legislation coming forward soon on how we're going to strengthen gun control in this country.
Following up.
Yes, on another matter, some of my other colleagues in Toronto reported this week also that Ontario Premier Doug Ford rejected the advice of his own public health experts when making the province's COVID-19 restriction levels. With cases surging in the province and projected to hit, as you said, 600 or 6,500 before Christmas. Given this report, do you still trust the Ontario government to make these life and death decisions based on scientific advice? And did you raise this with Premier Ford in your call yesterday?
We had a good conversation with the premiers last night, at which each premier, one after the other, talked about the additional measures they're going to be bringing in their regions. We're seeing a really troubling surge across the country. The fact that Dr. Tam is highlighting that modeling predicts 10,000 cases a day across the country by early December, if we do not bend the curve, should be a wake-up call for everyone. We know that the optimal path is for all of us to work together. It is best when we move quickly and firmly to bring in measures that are going to keep people safe, and we continue to impress upon individuals the need to reduce their contacts, to avoid gatherings, to do the things that we know keep us all safe. The job of the federal government in this is to continue to be there, to work with the provinces while they make those decisions, to support them in the decisions they make, but also to continue to be there for citizens. We know that these additional closures will have an impact on businesses and on families. That's why from the beginning, the federal government has been there to support people, and we will continue to be there, whatever it takes, for as long as it takes, with support for individuals, support for families, support for seniors, support for small businesses, including direct support on rent that doesn't go through the landlord, it goes directly to tenants, an increase to the CEBA program, which is interest-free loan of another $10,000 up to $20,000 interest-free. These are the things that we need to continue to do so that all of us can remain safe. I know we're getting tired of this. We want COVID to be done, but it's not done with us yet. So we have to keep doing what we need to keep Canadians safe until the vaccines start to arrive.
Answer repeated in French. We all must do our part. Yesterday, I spoke with all premiers. The premiers talked about the challenges and problems in their regions and the measures that they are implementing in order to limit the spread of the pandemic. I would like to reassure everyone that the federal government will continue to be there for you. The federal government will continue to support provinces, as we have done in investing and spending billions of dollars for testing, for PPE, to help vulnerable Canadians, to help schools and school systems. We will also be there to directly support citizens everywhere in the country. We are directly supporting those who are unable to work, those who lose their jobs. We are directly helping businesses who are suffering due to local shutdowns. We will be there for everyone for as long as it takes to get through COVID-19, and we will get through it together.
On the phone.
Thank you. Merci. Prochaine question, Hélène Buzetti.
Next question, Hélène Buzetti, Le Devoir. Hello, Prime Minister. Earlier, in your opening statement, you said that you told the premiers that Ottawa's financial resources are not infinite. What was the context of that statement? Answer, Prime Minister Trudeau. I talked to the premiers about limited resources. I was referring to the Red Cross, for example. Also, assistance in contact tracing, assistance to provinces in managing their situations locally and regionally. It's very difficult if we have limited resources. We might at some point have to choose between helping one region or another. We want to avoid having to make such tough choices. The best way to do so is to ensure that we clamp down on COVID-19 spread now. We want case numbers dropping as soon as possible. That way, we will be able to support everyone. Our resources, our physical resources, are not unlimited, especially
that I did highlight is that our resources are not infinite at the federal government, whether it comes to support on contact tracing, extra support on PPE, support through the military or the Red Cross. We are there to support the provinces as they handle this pandemic, but there is a threshold beyond which, when the cases spike too much, we might have to make really difficult choices about where to deploy the limited resources we have. We're not at that point yet, and we're continuing to be there to support the provinces in every way we can. But that sort of impresses on us all how much we need to get things under control now. As hospitals start to get overwhelmed in various parts of the country, as resources start to grow thin, as people are giving up on contact tracing, the federal government can add more, but not an unlimited amount. That's why we all have to make sure we do not get to the kinds of spikes that are being projected, that with the approach of winter, we all realize we've got to get this back under control, and everyone needs to do their part.
Economic update with a $15 billion deficit. It was presented yesterday. Quebec is counting on you, the federal government, especially to increase health transfers. Currently, we're receiving $4 billion per year. Here's the question. Will Ottawa be able to drastically increase health transfers? Answer, Prime Minister Trudeau. We are here to help. The federal government has invested to help Quebecers and to help Canadians everywhere. Provinces have also had to invest massively. The federal government, it is our job to directly help Canadians and Canadian businesses everywhere in the country. When it comes to municipal budgets, the federal government has substantially invested, and we can see that that has directly helped cities such as Montreal in order to have more balanced budgets despite major pandemic spending. We will continue to be here. We will continue to do what we must to help. We will continue to work with provinces, and we'll see what the outcome of the call will be. Last question over the phone. Next question, Lina Dib, La Presse Canadienne. Prime Minister, have you set a date for this call? This call in early December to discuss the Canada Health Transfer. Can you confirm whether a date has been set? Also, getting back to Hélène's question, will Ottawa invest enough to help provinces with their budgets and balance their budgets? Answer, Prime Minister Trudeau. I have been committed for a long time now to discussing health transfers with the premiers. I have suggested that we discuss the matter on December 10th. The meeting is still being organized. We will choose a date that works for everyone. I look forward to this discussion. We have not yet had the discussion. As I've always said, our goal is to help everyone get through this pandemic. As for recurring, ongoing spending and costs, I'm willing to discuss that with premiers. My priority, though, what's really essential is to take the necessary action over the next few months and ensure that we have the resources we need to get through this. Follow-up question. I wasn't able to ask my question to Minister Qualtrough earlier, so I'll ask you my question, and I hope that you'll have an answer. Quebec is considering making its Christmas break longer. What will this mean for parents? Will there be government benefits from Ottawa to help these parents? Answer, Prime Minister Trudeau. We are here for Canadians. We will help Canadians get through the pandemic. As I've always said, we will support Canadians, all Canadians. Different provinces, different regions will have to take certain decisions, take some action. No matter those decisions, we are here for Canadians, businesses, families. Quebec hasn't yet made this decision to which you're referring. Our approach, as I've always said since day one, is to be there for Canadians. If families are struggling because of the pandemic, because of shutdowns caused by the pandemic, we will be there for those families. We will have more details and more information in the days to come. we would have to discuss these measures on a case-by-case basis. I need to reassure families that the government is there for them. We started by helping with the CERB. Now we have many benefits to help Canadians who need support, and we will continue to be there and to offer support.
Good morning, Prime Minister, doctors, ministers. David Aiken, Global News. I want to come back to the meeting that's going to be held on the Canada Health Transfer. Notably, the readout from your office made no mention that there would be this meeting. And so I'm curious about why the omission in the readout, and then why the change of heart, because premiers have been asking for this meeting for a long time, and now is the right time for this meeting. So can you give us a little color on your thinking on that?
I have said from the very beginning that I was going to hold a First Minister's meeting to talk about the Canada Health Transfers. I've been saying that for months. I know this is extremely important to talk about support for our health systems, particularly during this pandemic. That's why we stepped up as a government, transferred $500 million in health transfers to the provinces in the first months of the pandemic. We did more again in the summer with the Safe Restart Agreement. We've transferred $19 billion to the provinces on Safe Restart, an extra $2 billion for the Safe Back to School Fund. We've continued to transfer directly to individuals in every province, to small businesses in every province. We've given direct support for PPE and through PPE to health systems across the country. We're going to continue to be there. Like I said months ago, I'm happy to sit down with the premiers for a First Minister's meeting on the health transfer, and I've indicated to the premiers that we should look for a date that works for all of us in the first 10 days of December, and I look forward to that conversation.
Thank you. Next question.
Stephen Chase with the Globe and Mail. Thanks very much, Mr. Prime Minister. I'm here to gauge your concern about a statement from CSIS this week on harassment and intimidation on Canadian soil that's carried out by and for the Chinese government. CSIS issued an unprecedented statement this week to the Globe saying that the Chinese government routinely uses undercover state security officials and proxies to target members of the Chinese Canadian community. We're talking immigrants, permanent residents, people who've become Canadian citizens, to target them in an effort to silence critics of President Xi Jinping. They say that this includes threats of retribution against their families back in China, and that it said these illegal activities are part of a global campaign of intimidation that constitute a threat to the country's sovereignty and, very importantly, the safety of Canadians. We talked to immigration lawyers in Toronto and Vancouver who say this is now standard operating procedure for the Chinese government. So does this worry you? How much does this worry you? And what more can your government do about it, including possibly a foreign agents registry?
We have seen over the past many years various countries using agents and various pressure tactics on local media outlets in Canada, ethnic media, but also in different citizens in different diaspora communities. This is something we have long been concerned about and have taken action on many times over the past years. At the same time, however, we've seen a shift in the approach that China is taking on its more coercive diplomacy, whether it's the arbitrary detention of two Canadians in the two Michaels, or whether it's a significant hardened posture when the concerns about human rights that Canada always brings up when it engages with China and other countries that have problematic human rights records in China, whether it's the situation around Hong Kong or the situation with the Uyghurs. We've seen China responding more forcefully, which is one of the reasons why Canada has worked very closely with like-minded allies around the world who are all experiencing various degrees of the same kinds of pressures to really hold a common front, to move together and demonstrate that this behavior is simply not something that is either productive for China's interests in the medium and long term, but more specifically, something that is not acceptable in a country and in a world where the rule of law needs to be respected and held up. Ça fait plus
Answer repeated in French. For a number of years now, we have observed foreign actors trying to wield influence on members of their diasporas in Canada, be it through the media or by influencing individuals. Unfortunately, recently, this has intensified in China. Their diplomacy has become more coercive and more aggressive. The most significant example of this is the detention of 2 Canadian citizens, Michael and Michael. We are criticizing, condemning, denouncing all violations of human rights. For example, we condemn the situation of the Uyghurs in the western part of China, as well as the situation in Hong Kong. We will continue to work with our allies and with like-minded countries. With our allies, we will fight back against this aggressive diplomacy. It is not in China's best interests, in the short, medium, or long term, to act this way. They will not gain what they hope to gain by acting this way. This type of pressure exerted on countries like Canada or on Canadian citizens will not get them anything positive. This type of diplomacy, positive diplomacy, creating well-being for all. Next question, Julien Lapointe, Radio-Canada. Mr. Trudeau, earlier this week, you asked mayors and provinces to do their share to protect Canadians and the health of Canadians. Are you satisfied with the action that provinces have taken? Do you have any examples of action that you support or don't support? Would you like to add to the message you sent out earlier this week? Answer, Prime Minister Trudeau. On our call last night, many premiers informed us about additional action that they are taking. That's very encouraging and positive. Am I satisfied? Well, we will all be satisfied once we see COVID-19 cases decreasing. We will be satisfied, we will be relieved when we see outbreaks under control. We see healthcare systems in some provinces which are overwhelmed. That is what we are watching. That is what we are trying to address. Provinces are doing their part. The federal government is doing its part. We will continue to help individuals, businesses, and provinces. Canadians individually must also do their share. They must make wise choices in the days and weeks to come. They must limit their interactions, and that's how we will get this pandemic under control.
These rising numbers, are they evidence that some provinces have not been doing enough to control the spread of COVID-19? Is there a point as well where you've got to say, well, jurisdictional lines don't matter anymore. We've got to go in and put in restrictions of our own. And also, what do you think these numbers mean for Canadians who are hoping, maybe, to get together with family over the holidays?
I think a lot of Canadians are looking at the holidays, hopeful that that'll be a moment where we can gather again and see loved ones that we haven't seen in a long time. Whether or not we're able to do that depends entirely on all of us doing what we each need to do. The federal government needs to continue to be there to support and provide extra resources to provinces when they're struggling, when they're facing large cases. The federal government needs to be there to provide resources to families, to individuals, to small businesses that are facing closures, and that's exactly what we're doing. Provinces need to make the right decisions around bringing in rules that will limit close contacts, limit the spread of profiles across the country, very different behaviors across the country, and the provinces are themselves best positioned to know what they need to do. The science, the body of evidence that's out there across the country and indeed around the world shows clearly what best practices are. Moving quickly and firmly is far better than delaying and hoping that individual behavior will itself bend the curve. But yes, individual behavior is important. That's why while the federal government does its part, while the provinces are stepping up with new rules and restrictions, individuals right across the country need to do their part as well. When we see cases flattening a little bit, it's not a reason to say, okay, great, we don't have to stay tight anymore. It means what we're doing is working. People in Atlantic Canada, where they continue to have that bubble, are making sacrifices every single day in their daily lives, even though there are incredibly low number of cases there compared to the rest of the country. We all want this to be over, but it's not going to be over for many more months. How bad it gets in the coming months depends on all of us. So even if you don't know anyone who's gotten COVID, you can't say, okay, what I've done so far is working. I'm tired of this. Just want to see some friends. Because what we've done has worked until suddenly it doesn't work anymore for you or your family. We need to hang in there together for a little while longer, a number more months, especially with winter coming, people going inside, ventilation challenges, masks are going to be more important, but reducing your contacts, reducing the gatherings are going to be most important. And what we do in the coming days and weeks will determine what we get to do at Christmas. Je pense que
Answer repeated in French. I understand how frustrated Canadians are, but we must all do our part. The federal government will continue to be there to directly support families, businesses, small and large, workers. We will offer this support so that we can all get through this crisis. Provinces continue to make tough calls and take difficult action, but necessary action in order to limit anything that is dangerous or could increase spread of COVID-19. This might involve localized shutdowns or shutting down certain activities, certain types of businesses, in order to better control the spread of the virus. Individuals must also do their share. If you haven't gotten COVID-19 or you don't know anyone who has gotten COVID-19, that doesn't mean, oh, I'm fine, everything's fine, and I can stop following public health instructions. No, we must continue to follow public health instructions. The majority of Canadians are making the right choices, are acting safely. Some people, however, are really frustrated, are tired of the measures, and are not following them, and that contributes to spread. It is important that in the upcoming days and weeks that we tighten our grip on the situation, that we follow public health instructions. We can shape what Christmas looks like. Our behavior, our action in the upcoming weeks can change the course of spread.
My name is Mohammed. I'm with the Canadian Press. With small businesses really up against the wall right now, Bill C-9 is still in the Senate, and there is a need for a new bill to fix it. When and exactly how can small business owners expect to have a help with their rent?
We know this is a priority for businesses to get the help they need. We have projected the wage subsidy that will continue until next summer. We're moving forward with additional commercial rent assistance that will be retroactive to October 1st. So we know that that's coming. I told the premiers last night that anything they can do to encourage the senators that represent their jurisdiction to move forward quickly on passing Bill C-9 will be a big relief to business owners. But business owners should know that the federal government will be there. We are moving forward on this support, and they will get the support they need to move through this pandemic.
Mr. Gallagher, quickly.
Prime Minister, you've talked about the $19 billion that the federal government gave to provinces, but much of that money has gone unspent. Are you satisfied with what the provinces are doing with federal resources?
I think that our role was to make sure that provinces had extra resources to be able to get through the restart and this second wave. And we certainly did that with $19 billion, with money directly, $2 extra billion for Safe Back to School, which included investments in things like ventilation. I think it's important to remember that we're in a federation where the federal government is not higher than or more important than provincial governments. We work as partners together. And the provinces expressed a need for these supports, and we delivered these supports. They are to be asked by citizens in the provinces and organizations in the provinces of their provincial leaders. My responsibility as Prime Minister is to be there to ensure that people have all the tools necessary to respond to this crisis. And that's what we've done, with unprecedented direct support to Canadians and unprecedented transfers to the provinces to help them respond to the needs of citizens right across the country. We will continue to do that. We will continue to be there, and we will continue to do everything we can to get this spread of the virus under control.
Thank you, Prime Minister. This is all the time you have with us today. We will now continue with the ministers and doctors for questions, starting with the phone. Operator.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, hi. This question is for Dr. Tam. I'm wondering, we've seen a lot of provinces come out with their own guidelines and restrictions. Ontario certainly has, and they've come under criticism for their rules about when they start offering restrictions in terms of test positivity rates and the number of new cases. I'm wondering what you make of the provincial standards that have been set, and is there a standard that you think maybe could be national?
Yes, so we have extremely regular meetings with other chief medical officers of health, and they've expressed the fact that the decision-making is actually complicated. It's not one single indicator, and their contexts are different. But I think our core messages have always been the same. And I think now more than ever, reducing those contacts that are not essential outside your household, all of those messages are consistently heard. But I think they are reacting to their own situation in terms of the epidemiology. But I do think there's just common core things that expressed our collective messaging about these core measures, which you keep hearing us repeat. And I keep telling people that reducing the number of contacts right now is really important. Several, at least a couple of modeling sessions ago, we've said, if we don't cut down contacts by 25% in concepts. The other concept that the Prime Minister also said is to act quickly and then be really careful when you are relaxing at the other end, because what will happen is that given winter is coming, people going indoors, you may see a rise again. So this yo-yoing and up and down is really very difficult for society and for individuals. So, as jurisdictions, make a concerted effort to flatten the curve, got to be really careful about emerging from that side once you flatten the curve, because winter continues for a number of months, and this is the most concerning period of time. We are, obviously working hard at vaccine preparations, but that's going to take time. So we need everybody to making effort. I mean, from where I'm sitting, anywhere outside of the Atlantic bubble, the Atlantic jurisdictions and the territories, fires are burning in so many different areas. And right now is the time to get those under control.
Follow-up?
All right, we'll take the next question on the phone. Operator?
Thank you. Merci. Prochaine question, Hélène Buzet.
Next question, Hélène Buzetti, Le Devoir.
Question is for Dr. Tam. A few weeks ago, I lost track of time, but you suggest that we now wear a mask with 3 layers. And on Health Canada website, it says that third layer, that filtering layer, can be made of Scott towels. Yet in Quebec, this material has been tested and it's not proven to be effective. So I wonder why you still recommend people to do their own filters with, Scott towels or things of the like. Thank you.
Yes, as I said, the science is always evolving and we're learning a lot more about different materials. But we have, and I think this question was answered through written answers before, and there are references and work done in Canada during the last months and recently, including universities in British Columbia, that looked at a whole range of materials. So while unwoven polypropylene is one key suggestion and is accessible, the folded paper towel, although less efficacious in some dimensions, is a very readily accessible material that has been tested in those studies. So we can get back to you to provide you with those references, but that's how we came up with it. This is partly that is being recommended, including tightly, high thread count cotton being a very useful layers. So, but again, we will all learn together, different areas of Canada as people.
Yes, well, it's still not clear to me because this study was done in Quebec and they says it provides barely no supplement, no additional protection. So I don't know why bother telling people to add that and change their mask to provide a space to put that piece of paper if in fact it provides no significant additional protection.
Well, we can provide you with the reference with the results of some of those testing. And, I can't say exactly what methodologies used from the Quebec study versus some of the other academic studies, but we can certainly look into that for you. But based on our research and the references that we looked at, it is an alternative. But we also recommend, as you know, the unwoven polypropylene as people upgrade their masks.
Thank you. We'll now turn to the room.
Bacon, Global News. Got a couple. First one from a colleague who notes that the WHO and CDC, I think, recently published a new report that found measles have reached a global 23-year high last year. So wondering, how has COVID-19 affected immunization efforts for other infectious diseases in Canada? And is there any concern there could be a spillover effect once the pandemic is over?
I think there's a global concern because there's a big effort to eliminate measles. What I was really amazed at was the actual polio eradication in Africa, even during COVID-19. So it's possible to maintain these efforts, and I think we all have to be reminded to do that. And we've been messaging to, obviously the province and territory run their immunization programs, but we've been messaging to the Canadian public that they should get their routine immunizations. And those can be done safely. Clinics know how to put in measures to reduce the risk of COVID-19 transmission while providing really important routine prevention measures, including routine childhood immunization. So that's a really important message. We have not seen measles cases or escalation of that in Canada during the last months, but that doesn't mean it couldn't happen. So that's a really important thing to do.
Switching to home testing kits, I was speaking to some epidemiologists yesterday, and one mentioned that home testing kits, widely deployed, have a great potential to really stop this pandemic in its tracks. And another said, yes, maybe, but I understand Health Canada is going slow in terms of approving one. Some other jurisdictions approved them, and there was a lot of false positives to make them sort of useless. So I wonder if I get your sense where the potential for home testing kits and where PHAC sees potential rollout for home testing kits for COVID.
Yes, so the standard like PCR, that has to be sent to a lab, but I believe we mobilized over 3.8 million rapid tests in the last little while. So those have to be maximized, obviously, in terms of their usage. And the number of tests being utilized a day is nowhere close to those capacities. So we know that there's more that can be done. And we're, certainly looking at how else we can support provinces in mobilizing those kind of tests. So then it comes to, well, how do you deploy a home-based test? Just deploying a test, because that's after you get sick. The prevention side is really important. So following those public health measures is really important. The test is only there when you actually got sick. So that's something that we have to be aware of. So far, as I know, Health Canada has not approved it. We welcome the submissions, but we haven't yet received one and got sort of satisfactory information from the manufacturers or that we need to test it in clinical terms. But it is not a substitution, I guess, in the end for the other measures. And how do you mobilize that? I think we should look at everything. But right now is not an option that's available at the moment. But as you know, a negative test under any of those circumstances doesn't necessarily mean you don't have the virus. So, which means repeat testing. So some of these tests, if you're going to do them, needs not just one test, but serial testing. So those are the parameters that we're going to have to look at, and should these tests become available.
Thank you. We'll take 4 more questions in the room.
Dr. Tam, hi, Tonda McCharles, Toronto Star. First, what advice have you given to the Prime Minister that allows him to say today to Canadians to leave open the possibility that they can still gather together for the holidays? You said a couple of weeks ago, I think, that big parties are off, big gatherings are off, that people will not be able to do that for the holidays. So now what advice are you telling him that allows him to tell us today that that's still an open possibility, we can still gather?
But I have to say that given the projection that we have now, which is we could get to 10,000 cases by the beginning of December, if we didn't cut down on our contacts and drastically flatten this curve now, I think it's very unlikely that by the holiday season that I don't think anyone's advocating parties. This is not going to be a normal Christmas, but you can have safe and a fun Christmas that includes social connection if you do it safely. And so I think it's, that I think still is the core message, but right now it's not looking good. People have to really take everything seriously and look at provinces in the prairie area. So, that's a long ways to go for those regions if you're going to have Christmas celebrations. So I still think that most likely right now is, stick to your household. Be very careful if it's beyond your household to limit those contacts. Make arrangements and plan, because if you are going to meet family, you can prepare ahead of time. That some of the resurgences that I've heard from my colleagues might be related to every one of those preceding gathering sort of events like Thanksgiving, may have increased acceleration in a number of areas of Canada. So we have to be really careful about those time periods. We'll understand how important those events are to Canadians. But there are ways to do this safely. Halloween, there were, obviously recommendations to try and do those as safely as possible. But people still went and had some social gatherings, which set off resurgences that cannot be done. Right now, that is not recommended.
And my other question,
In French, please.
En français.
Tenu, s'il vous plaît.
Okay,
I'm very lucky to have Dr. Nu here. Right, when it comes to Christmas, we're going to celebrate very differently this year. It's going to be very different, you know. Our actions matter. What we do today matters. And our actions today will determine what will be possible during Christmas or the end of year holidays. If I look at what the Prime Minister said, well, I don't think that big, large families in Quebec will be able to get together. You know, it depends. If the trend keeps heading the same way, and we're thinking that there may be more than 10,000 daily cases towards the end of the year, well, if that happens, then we're going to have to limit those gatherings. You know, even seeing a few family members may not be possible. So it is very important that we do everything in our power today to limit the spread of the virus. It's very worrisome to see the hospitalization rate rise. And Dr. Tam also said earlier that even though there's lots of advice being given by the Public Health Agency, and that was the case during Halloween, well, 2-3 weeks later, we saw that there was a rise in cases. So every single Canadian has to look at themselves hard in the mirror and ask themselves what they can do today to plan differently. Maybe they should plan a smaller gathering just so that it's better than nothing, right?
The Ontario government did not consult some of its scientific experts and in other cases ignored the advice of its medical experts consulted on the new closures and what measures need to be taken to curb the rise of infection. So do you still trust the Ontario government to make these life and death decisions?
Health is in the provincial jurisdiction, of course, but I try very hard, and we have very, very frequent meetings with medical officers of health to try and to work together to come to consensus and to support each other. So I think the key is to, at least from my perspective, to support as much as possible my public health colleagues. And that is really important because I think cohesion and ensuring societal cohesion, in addition to public health professionals coming together to discuss best practices and the way to go, is really important. It's one of the major ingredients to tackling this pandemic. So for sure, I'm in constant discussion with my colleagues. And as the Prime Minister said, we're here to provide surge or support as needed.
Thank you. I know Minister.
I was just going to add to Dr. Tam's point. I think, maybe I'm speaking for myself personally, I think as a public health physician and expert, our job really is to look at the evidence, the science, and do the analysis, the interpretation, and then give our best advice and recommendations to our political masters, the sort of the decision makers. And I'm sure that's what's happening across the country with our counterparts in the provinces and territories. At the end of the day, I think we recognize the elected officials are the ones that make sometimes the final decisions. But certainly, as Dr. Tam has noted, we have a very good sort of discussions with our counterparts on a regular basis, and we're all on the same page in terms of looking at the science, the evidence, what are the good public health measures that need to be put in place. And at the end of the day, we give our best advice to the decision makers.
Thank you. I know Ministers Leblanc and Minister Qualtrough need to leave for meetings and such. So if your question is for ministers, please step forward. All right. Thank you, Ministers. Oh, you have one? Okay.
Bonjour. Maybe.
Hello.
Sur la question du temps des fêtes.
I have a question about the holiday season. As ministers, can you tell us how you are preparing for the holiday season given how cases are on the rise? Mr. Leblanc, I see you're smiling. Are you planning anything with your family? Answer, Minister Leblanc. You know, at Thanksgiving, I bought a 23-pound turkey, but it was just my wife and I. So we ate turkey for many days in a row. Some of the turkey was wasted. We'll have similar situations at Christmas, at holiday time. We will follow public health advice. We will follow the advice of our experts. I'll be home over the holidays, at home in New Brunswick with my wife. My wife and I are going to do some winter activities in the snow. Answer, Minister Qualtrough. There was a question about eligibility for the caregiver benefit, a question that was asked to the Prime Minister earlier. If schools close for regular holidays, then there will not be eligibility for the caregiver benefit. However, if schools are closed for longer because of COVID, then of course those who stay home will be eligible for the caregiver benefit, the COVID caregiver benefit. As for the holidays, my family's going to have a little celebration. My two kids are young. They're 8 and 10 years old. Santa Claus will, of course, be visiting us, and we'll have a little family gathering. Thank you. Those are all the questions we have today for Ministers Qualtrough and Leblanc. And now questions in the room.
Perry with CBC. I just wanted to know a pretty specific question. Do you know how many rapid tests have been delivered to Ontario, what kind of tests they are, and if they're being used?
We will have to get back to you with that. All I know is for the country, we've deployed 3.8 million, so I am not entirely certain. Could we get back to you on that one? Yes.
You don't have that. Do you know what the freezer, I know that the Pfizer vaccine requires this extreme kind of cooling. Do you know what our capacity is right now? Like where we stand, like I guess universities, hospitals, things like that. How much capacity do we have for storing this vaccine right now?
So what we're talking about is the Pfizer vaccine with the ultra cold temperature. So I think, as I mentioned on the last briefing, that the capacities are being mapped out across the country. But I actually think there are special arrangements with the manufacturer itself. So it's not simply a matter of who has a freezer where. The details actually with working out with Pfizer. And it may or may not be that transportation and freezer piece. Of course, we will support the provinces as needed, particularly in the ultra cold chain, which is being mapped out right now. But it's also, you kind of have to use everything fast after it comes out. So those details are absolutely being worked out as we speak, basically.
Hello, Dr. Tam. This is Stephen Chase with the Globe and Mail. You mentioned that if we don't change our behavior, we're going to hit 10,000 cases a day, new cases a day. Can you be more vivid for us? Can you paint a picture for Canadians of what the hospital system, the healthcare system is going to look like at 10,000 cases a day? For instance, what are the challenges we're going to run into at that point? What are going to be the difficult decisions?
So, thank you for the question. Even now, which we're, essentially at close to 5,000 cases a day, some areas of Canada have seen that they've now had to scale back on routine medical procedures because their hospital beds are getting full. There there's much concern about ICU capacity, not because we don't have ventilators or, equipment, but because you have specialized medical resources, personnel, and they're getting exhausted as well. So this is at 5,000 cases a day. So you can only imagine that if we got to that level, that the pressure on the healthcare system would be huge. You would definitely not be doing routine surgeries, and that the already exhausted healthcare workers will be, extremely stretched. We only have to look towards some of the European countries to know some of the effects that can have, which means that the brakes, if we don't put it on now, can have a severe impact. And it's not just the healthcare system. So you can imagine, hospitals being full, you're canceling surgeries, ICU capacities, but also the public health system itself. So the testing, contact tracing, isolation is already stretched in certain municipalities and areas. And so unless you then reduce gatherings and put those restrictions, that is not going to cope. So that is a very sobering, really sobering picture for people to sort of keep in mind as we go about doing our utmost personally to prevent that from happening. So right now we got to stop the acceleration so that we don't see that at the beginning of December, and that's only a few weeks away.
Yeah, it's Dr. New, if I can just add to that, I think just look at what happened in the spring. I think what happened in northern Italy and in New York City, where you can see the news reports. Doctors were at the present time, but I think it's sobering. Just look at the experience of what happened last spring, and certainly at this point, with the case numbers rising, the ICUs becoming fuller, we can sort of see that worst case scenario, and that's something I think, as Dr. Tam has already stated several times myself as well, we need to do everything we can now as individual citizens, do our part to stop the chains of transmission.
Thank you. Last question in the room.
Hi, Dr. Tam.
Question. J'aimerais parler des Raptors de Toronto. Ils veulent jouer à domicile à Toronto. En tant qu'expert de la santé publique, que pensez-vous? De quoi ont-ils besoin pour obtenir ce mieux? C'est l'expert en la matière, donc je lui laisse répondre à la question. La balle est dans votre camp. Réponse. Bon, je suis fan des Raptors et d'ailleurs, je suis encore ravie du dernier championnat et je les encourage à faire.
I will also say we've had a good discussion. I've been involved with discussions with the Raptors organization, not myself just alone, but obviously with other colleagues within the Public Health Agency of Canada, but also involving public health officials at both the provincial and also at the local level, the City of Toronto. I think what I would say is that the Raptors have presented very good protocols. I think they've learned a lot. I think it's been a very successful, let's say, experiment or lessons learned from what they did with the bubble in Orlando. What I would also say, though, is that it was a controlled environment. And then certainly what the NBA is planning for the regular season is not the same thing as the bubble concept. It will involve teams being in their home cities, traveling across the country. And in our case, the issue, again, of the cross-border travel. So from a technical point of view, we have received their protocols where we're continuing to look at them. I would say they're very good in terms of the testing regime, some of the expectations of the players to be put in place. I think the tough part, I think, really, even for the players, is the discipline. You can imagine what they had to do during the time they were in the bubble in Orlando. And now do the same kind of measures, but not in the same environment for several months for a regular season, I think will be tough on everyone involved. For ourselves, I certainly, I think that the cross-border travel continues to be an issue. I think that we will continue to look at the epidemiology of both COVID-19 in the U.S. and in Canada, and that will certainly be part of, I think, thank you.
Thank you. This is what concludes today's press conference. Merci.
Thank you. The conference is now ended.